Hey there, I'm Dave Radick.
And I'm Jennifer Radick.
We're here to tell you my story of my aorta dissection back in May 2020, and also like to get the perspective of my wife, Jennifer, as my caregiver, to see what she went through at the same time. So it started back in April, end of April 2020. I was not feeling well. My chest felt a little weird, I guess. So I called my PCP. She ordered me a Holter monitor. So I went to the hospital, I got that, I guess, hooked up, attached to myself. I wore it for about 4 to 5 days or so,
Mhm.
and then never really got the results back because when I was leaving work one day, I was driving home on the turnpike and I called my wife. I was like, "Where am I? Why am I in this car?" So she was kind of freaking out at the same time, but trying to keep me calm.
Well, because how many times did you say that?
Yes, I kept on saying it over and over again.
Every 30 seconds?
Where am
Man.
I? Why am I driving this car? Because I was in my daughter's car at the time. So my daughter got on the phone. She was talking to me. In the meantime, my wife called the 911. I kind of stopped at a rest stop or
Mhm.
a interchange at the turnpike. They picked me up, took me to the hospital, and again, it was COVID time, so it was very hectic, very busy in there. Wouldn't let my wife in there. Um, so did a bunch of tests, and they said it was a TIA, and that I'd be safer at home.
So I'll just
Yep.
so a TIA is a transient ischemic attack. So it's sort of like a mini stroke. So which is what they said. He was having a mini stroke. They sent him home. They said he would be safer at home. And so they brought him out to the parking lot because I wasn't allowed in with him, and then told us to go home. So we went home, and then
Yep. And then stayed home from work the next day. And the following night, I woke my wife up saying that I felt like something was sitting on my chest, super heavy. So she took me to the emergency room. And again, it was COVID time, so she wasn't allowed in. There were barricades up. So I walked in there. They did a bunch of tests. I guess maybe a CT scan or something. Not really sure what they were doing.
they did like blood tests for a certain lab, a D-timer, I think it was, like two different tests indicating like heart damage. And so I was still sitting out in the parking lot, and they called me from the emergency room and told me that there was some, definitely some damage. The blood levels came back very, very, very high, and told me to go home and get, some clothes for him. And then, by the time I got there, they had called and said he was on a helicopter and he had less than an hour left to live. So you want to,
Yeah.
what do you
So
remember?
So I was kind of like, as I was laying in the hospital bed and waiting for the transport to come pick me up, I'm here texting my wife with information like pension information, bank accounts.
You okay?
Yep. So they took me down to the hospital, and after they I was just kind of laying on the table, and that's pretty much all I remember until I woke up. I guess the next day or so. Um,
You want me?
sure.
Okay. You want to break? Um, yeah. So I ultimately, he went from, not, he went from that morning, I guess, or early in the morning, that the moment that he had said that somebody heavy was sitting on his chest, to kind of us really getting to the university, the local hospital, who then again really did a fabulous job of correctly diagnosing him at that point, getting him on the helicopter. Again, it was COVID time, so like I couldn't be with him. It was not related to the pandemic. My family couldn't be with me, like my mom, my sister, his mom couldn't be with us, so the kids couldn't be with him at the hospital or anything like that either. So they did allow me to come down to the hospital. Probably about 14, 15 hours later, they did the surgery. They had told me, they had called me when they said that he was on the helicopter, and literally they said he had an hour left to live, that he had an aortic dissection. The TIA that they referred to the day before was actually a stroke. And so he had an aneurysm and a stroke that day before. And then at that time, I had already dissected. So he had the type A aortic dissection and a type B aortic dissection. He dissected in the ascending and the arch and the descending part of the aorta. Um, he also had the coronary artery, right? The coronary artery that kind of got sheared off to his brain. So that was, obviously another complication. He did have the type B dissection as well. So when they finally let me come down, they had said, okay, now the hard part. And I'm like, what do you mean? And they said, well, he needs to wake up, he needs to not have another stroke, and he needs to be able to be, what's the word, like not come off the intubation.
Yes.
Yeah. So then like I said, I was able to, they allowed me to come for 1 hour, then I had to leave. And then early the next morning, I called to see how he was, and they did say that he woke up. So what do you remember then?
And then I was talking to you on the phone, and then all of a sudden I started slurring my speech. And then I kind of got frustrated and hung up.
Yeah.
On the phone, yes.
Yeah. And so when I was there, well, I was there in the morning. So I was able to come down that morning. So the very next morning he did wake up, and so that happened actually afterwards that night.
Okay.
So yeah, so that the very next morning when he did wake up, they allowed me to come down again to the hospital for 1 hour. Again, the kids were not able to see him. We have a 21-year-old, a 24-year-old, and a 26-year-old. And obviously this was 5 years ago, so they were younger then. But they were not allowed to come to the hospital to see him. They were not able to join me for that 1 hour. And he was awake. He obviously he had gone through something so traumatic, but he was awake. He was talking. We hike a lot. So for those of you who do know us, we do hike a lot. So we were actually talking to the ICU nurse about hiking and different places that we had gone and where we had, continued to plan to go. And of course, everything was sort of on par for what he had just gone through. And then I had to leave after the hour was up. And then I don't know, that night, I guess, maybe we were talking a couple times throughout the day. But that night he was slurring his speech. He just didn't seem himself. He hung up. Also not him. That's something he would do. So I called the nurses station and kind of was getting, they were just sort of saying they were great, but at the same time they were saying, he had just been through a lot. He's just tired. And I said, you were in the room with me and he was not talking like that. We were talking about hiking and Sedona and Zion, and he can't even get these words out right now. And ultimately kind of felt dismissed, to be honest with you. Do you remember? You don't remember any of that?
Yeah.
So I felt dismissed. So I guess one thing would be if you are in a position like I am and you're you're caring for someone, or you're whatever the case may be, you should continue to advocate, and just trust your gut. So I basically I asked to talk to the neurologist and said, I've known and loved this man since we're 18 years old, and this is not how he talks. This is not how he behaves. Something is wrong. And sure enough, they did another scan and he had another stroke. So he did have another stroke right afterwards. And do you remember what happened after that?
No.
Okay. um, okay, so after that, they treated him for, the stroke. And then he was there for, I guess, a total of less than a week. So believe it or not, he was the type A aortic dissection, the stroke prior to that, the aneurysm, the coronary artery kind of getting sheared off and having to be reconnected during that very, very long surgery. And then also the stroke afterwards. He was home in our house in less than a week. Because of the two strokes that he had had already within a short amount of time, just in an amount of days, he did have to have cognitive rehab and speech rehab here at our house. So we would have visiting nurses who would come and care for him. But we should probably back up and tell them like what is all here.
With what?
Here, like your mechanical
Oh,
valve and
yeah. I have the mechanical valve, the St. Jude arch. Um, After, fast forward, I guess.
okay.
A couple of years later, I also have a a stent or a couple stents in there after going to the cath lab. Also had the TVAR, I believe it was called,
Mhm.
procedure with the bypass, the coronary, thoracic, or coronary.
Yeah, we just call
Yeah,
it TVAR.
yeah. I bypass to fix the type B dissection. Um,
Yeah, I think
what
we
else?
well we kind of skipped
Yes.
some stuff. So maybe we'll go back to the so for his aorta, as I mentioned, he had the stroke and then he had the type A dissection and the type B dissection. So the type A aortic dissection was treated by he pretty much has a whole aortic rebuild is what they call it. So his entire, we call it the candy cane, I guess. That's how it was described to us when his surgeon was drawing us pictures and trying to help us understand this because this was all new to us, which we should get to at one point as well. But his whole aorta is kind of a synthetic graft made out of graphon. Graphon? I think no. Yeah, something like that. It starts with a D.
I don't know.
I forget. But we're not prepared for that. But so that's all synthetic. And then he does have the mechanical valve. So that's he had mentioned the St. Jude's mechanical valve. So you can hear him ticking. So just so we sleep with a sound machine. So at any given moment, and thankfully it's like the best sound. But you can hear him just ticking by standing next to him. And so do you want to tell anybody about that?
With my ticking
Yeah,
sound?
the ticking. How did you like getting adjusted to that or
Yeah. So at first I didn't even know I had it, and then I was getting PT at the hospital, and the nurses were like, "What's that ticking sound?" And then one person said, "Oh, he's got the mechanical valve." So then they more I concentrated on hearing it, then obviously I can hear it in the hospital because it was super loud at that point. But it's it took a little to get used to.
Mhm.
Right now I can't make it. I don't even hear it anymore. Except when I'm trying to go to sleep, I hear the tick 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 tick. So like my wife said, we do have the sound machine on to hear it, and then about like on occasion at work, if I'm standing close to someone, it's like sounds like you're wearing a watch. It's like, what's that sound? And then I have to explain that I have a mechanical valve, and then they think it's pretty cool that you can hear it tick, and then go into some doctors, and they have like interns or medical students. They always find it
Like
very fascinating
yeah, they bring
to
him
come over,
over. Yeah.
yes, here, and listen to my heart.
Music to our ears.
Yeah.
Yeah. And we travel with the sound machine. So we have little mini sound machines. So if we do are going away. We just kind of throw it in our bag because we're just kind of used to that noise to drain out that very awesome sound. But you know, for him to be able to get some sleep, because it's obviously even more louder for him than the people that are you know, around him. So guess then we'll go back to the type B surgery. Well, no, actually we'll go back to July of 2020.
Okay.
Okay, so in yeah. So in July of 2020, we were, again, it's still related to, this is not anything related to the pandemic, but it just happened to be happening. It was coincidentally during that time. And we were able to kind of go out, restaurants were opening. And so he had mentioned the type A dissection and also the type B dissection. So type B dissections, they can be managed without surgery. He had that, plus he still had an aneurysm that was still being treated. So he has a cardiologist, and then he has the thoracic surgeon, the cardiothoracic surgeon, which, do you want to talk about that? Like how we didn't realize that they were even different doctors?
Yes.
Yeah.
Yeah. So at first I thought, you know, like a cardiologist just did everything for your heart, but um, they don't. They have special, you know, specialized, I guess, doctors for the surgeries and the preventive care and what other things.
Yeah, I mean, you have the cardiologist who does your medication and your warfarin, and we could talk about that in a little bit too, because he's on warfarin for the rest of his life. So with the mechanical valve comes blood thinners, warfarin. So there was another option that they talked about prior to the mechanical valve, which was, I guess, maybe a pig valve, I think, or bovine, I forget.
Yeah.
Which maybe wouldn't have been warfarin for the rest of your life, but that wasn't an option because of just the sheer damage to the aorta. Like I had mentioned, it's a complete rebuild. So the mechanical valve was the only thing that would have been an option for him. Plus, I mean, we'll be 52 in a couple months, and this was happened 5 years ago. So we were 46. So he was 46, so he's very young when it happened. There was no history other than the days leading up to that he had mentioned. Always healthy, played soccer, hockey, you know, we hike all the time. So this really just came out of nowhere for us. But yeah, so we didn't know that there was something called like you know, the cardiothoracic surgeons, and that there was a cardiologist, and then you have the neurologist, and you have the preventative cardiologist, and so there's a whole kind of care team in terms of that helped, you know, save his life, and then also continue to treat him for follow-up and any other kind of things that have come up, which there have been. But we also just kind of live our life, right? In terms of this is our new norm, and it's awesome that we are lucky to live our new norm. But um in July of 2020, so he had the type A dissection in May of 2020, and he also had the type B. But because it was so emergent and severe, and as we had described, he wasn't allowed to have the type B dissection surgery right away. So they had to wait and monitor. So you had the cardiologist who wanted his blood pressure to be, I don't know, higher or lower. I think he wanted it to be
Lower.
that's what I thought. And then you wanted the cardiothoracic surgeon to be higher, because that was impacting how much kind of the aneurysm was, you know, I guess, growing or shrinking. So they had to really agree upon a range of blood pressure. And so everything was going well. He was still home from work. I think at that point we were, I think, 7 weeks, 6 weeks maybe out from the event, and you were probably almost done, like you were probably done cognitive and speech
Yep.
therapy at that point. Yeah. So we were outside and we were eating outside. We were meeting friends for lunch, and when we hike, he will sometimes squat and not even thinking about it. he was standing outside like a store when we were outside of this outdoor shopping center, and he kind of got up, and because of the blood pressure range, I guess where he was, I'm not even sure. I don't know what happened, but he stood up, and he kind of stood up and just went down like a tree, like a timber. But I guess we'll talk about really go back again. We're sorry, we're all over the place. When he was discharged in May, after what, 6 days, I guess it was, we were signing the papers. They had to do the discharge with me over the phone because again, wasn't allowed in the hospital. So they had to bring him out and, wheel him out. We had to put him in the car, and that was all kind of done over the phone. But what they had told us was, okay, for the rest of his life, he's on warfarin. He's already had 2 strokes. There's sort of like a protocol, or you guys need to know that if he were to ever hit his head, he needs to go to the emergency room right away. Even if there's no blood, he needs to go to emergency room, because of the mechanical valve and also the stroke history. And then they also said you always need to know what his INR is. What is international? Gosh, we just are so good with like these initials. We should have looked that up too. INR, but his INR is pretty much what sort of like we think about it as the thickness of his blood. Yeah, the thickness of his blood. So because of his mechanical valve and the stroke history, his blood has to be thinner than everybody else's typically. So he tests at home once a week or once every other week, depending on what his like level of his INR is. So they pretty quickly got him being able to test at home. So we knew what his INR was, at home, typically even at the 6-week mark, I would say. So we happened to be again out with friends that day. And he was squatting, and whatever that was, it kind of messed up with his blood pressure. He stood up, he fell like a tree. We were with 2 of our kids, our daughters, and he kind of fell straight forward, had blood everywhere, had a seizure. It was terrible, it was horrible. I was like cradling him, blood everywhere. The girls were so upset. We were with friends again, they were so upset. We were close to the city hospital, so there happened to be doctors that were kind of walking by, 2 of them, ironically enough. And because of when, the one thing that they pressed upon us when I picked him up that day when he was discharged was, if he ever hits his head, he needs to go to the hospital ASAP. You need to tell the doctors what his INR is, that he has a stroke history, that he has a mechanical valve, that he had an aortic dissection. They'll be able to see all of that, but they need to know all these details. So I don't know what it was. I just kind of kicked in. It was just like, he's got a mechanical valve. His INR was 2.4. He's had 2 strokes 7 weeks ago or 6 weeks ago. And, 2 doctors just not even, they didn't even know each other. They just came over and they just sat with us and they called the ambulance. You can go.
You're doing good.
No, you can go.
Please.
Okay. Okay. Pause. So then the ambulance took him to the hospital, the closest hospital. They had to pick him up because it was considered a trauma at this point. So again, this is from May 8th to now it's like I think July 3rd. So less than 2 months. So probably like 7 weeks, right? And so the ambulance picks him up and takes him to the closest hospital because it's a trauma. So my friend and I, we get our girls together and, we make sure she works with me to kind of make sure I'm now having to get to the hospital and that I can get to the hospital because obviously this has just happened and the girls are upset, I'm upset, and away an ambulance has taken him yet again. So Dad, what do you remember?
So they take me to the hospital and everything, got all checked out. I was fine as far as the head trauma, no issues with that.
They
I
took
did
you,
separate.
well, they took you down. Well, no, before they took him because of everything that just happened. You don't remember they took you another ambulance back down to the city hospital. Yeah.
Yes.
So they took him to the closest trauma hospital when that happened by ambulance, but then they had to take him again back down to the hospital who pretty much saved his life. So he went down there, and then our other son, child, our son, went and picked up our daughters, and then I went down to meet him at the hospital. So he was on yet another ambulance to the hospital again, where who did all his repairs and his surgeries already at that point, 6-7 weeks ago. Okay, but then you can go and talk about what you were about to say.
So the hospital was, doing a bunch of tests with me, and pretty much there was no issues with anything. They just kind of said that since I was squatting and my blood pressure probably dropped by squatting, the blood just kind of didn't get recirculated back up to my heart. That's why I kind of fell. So there was no other like lingering issues with the dissection or anything.
You got this really nice
So I
scar
did get
here.
a scar on my thing. I separated my shoulder too at the same time. And then
You'd go to PT.
went to PT for my shoulder, which was interesting. And then
Tell them what happened at PT.
okay, so I showed the physical therapist, or not even the physical, I was the orthopedist before the PT. My one leg, it seemed, a lot larger than my other leg. So he kind of took an X-ray of it, and they said that I had a type A lipoma.
An
Right?
an ALT, an atypical
Yes.
lipotomous
Something.
tumor. Yes. An ALT, yeah.
Yes.
An ALT.
Which
So
is the size of like a soda can.
yeah.
It was very large.
Yeah, it was very large. And then we're only sharing that part to kind of get to what life is like, I guess, with warfarin and things in the last 5 years that we have to kind of take into consideration, I guess, in terms of everything that's happened and just all the things that are involved in terms of just day to day or routine things.
Yep. So then I guess a year or two later,
a year later, you had the type B dissection.
I had a type B dissection
surgery,
repair. And then
well, do you want to say what that was like? What that was? That was two different surgeries. You had to have so he had so he had to go in. So I guess going to the whole thing about like complications and everything. So because of the warfarin, and which again we're so thankful for because he's here, and it's it was so emergent and everything had happened. His surgeons, the neurologists, the anesthesiologists, the ambulance, the people that took him by ambulance, and the people that took him by the helicopter, everybody would come up to see him that first week, because they're just like, we don't even know how you are here, because we don't know, it's literally just a miracle. But because of the warfarin and the mechanical valve, and that's the new norm. That's life, there are certain complications and certain things that have to be taken into consideration. So, I mean, outside of just having to take antibiotics and stuff, just go to the dentist, right? Things like that, simple things. Taking antibiotics, just go to the dentist. Packing meds every single Sunday night, to kind of make sure that everything is, because there's a lot of meds involved for him. So, making sure that that's all done and remembering to take them. But one of the other things is because of the blood thinners is having to go in for any type of procedure, big or small, there's often what they call bridging, which means he has to come off of his warfarin. Excuse me, he has to come off of his warfarin so that he can have a procedure. And then he has to give himself injections into his belly every single day to kind of keep his blood INR, the thickness, the thinness of his blood, kind of at minimum, kind of where it, not really where it needs to be, but I mean, I guess where it can be for safely until he can get to have the procedure.
Mhm.
So he was having the type B dissection surgery, I guess about a year and a half after, maybe a year to a year and a half after the type A dissection surgery and all that. And so that was a lot of coordination. Again, there's a whole care team, the neurologist, the cardiologist, the whole team of the cardiothoracic surgeons, and several of them. And they have to decide on when is the best time to do it, and constant scans and making sure like this is the best time. So then he has to go into the hospital, and probably like several days to a week maybe prior to going back into the hospital, he has to do the injection. So he has to stop his warfarin, he has to do the injections, and then he goes into the hospital the night before. And then they put him on, at that point they put him on heparin, a drip.
Mhm.
So then now the heparin is able to kind of maintain his the INR, or I think that at this point they call it PT, maybe PT, I think, in the hospital, to make sure that his blood thickness is where it needs to be, safe for him. And then because then heparin can kind of come out of your system, I guess, a lot quicker. So then the next day he has to have the bypass. He had mentioned the bypass surgery. So you want to say about that, the shoulder, right? What that was?
Yes.
Okay.
So they put me under, and they did a nice little slice on my neck up here. Did whatever they needed to do. They put some type of stent or bypass or something up in there.
Yep, they had to like kind of bypass the blood that was going to be going from this
The
kind of like the
carotid.
shoulder area and the carotid, and then he had to heal for a day, I guess, right? And then so he's obviously was still in the hospital. And then so I think that was he went in on a Tuesday, and then that surgery was on a Wednesday, and then you had to wait till Thursday, and then that Friday, then they go in and do the TVAR surgery, and that is the surgery that is to repair the type B dissection that he had. So again, this is all in the last 5 years. So this was May of 2020, so it's October 2025. So it's been, I guess, 5.5 years maybe now, right? So it's complicated. We're very lucky. But that just to kind of demonstrate, just the everyday, the meds, the testing, the INR. He was saying about the leg, so that's another complication. Yeah. So do you want to say about that, or?
Yeah, so I had the procedure to remove the lipoma from my thigh.
That was August, so a year ago.
Yep, year ago in August. They bridged me at the same time for that. So I was doing the shots in my belly, a couple of days before that, and then go down for the procedure. And then coming home, or the next day, that my clinic for the warfarin management wanted me to take X amount of medicine to get me back up, as well as my surgeon wanted me to continue with the injections too at the same time. So at that point, like my blood,
Lobinux?
yeah,
Yeah,
Lobinux, yes.
yeah.
So at that point, my blood became super thin.
Initially.
So then I started bleeding a lot out of the drain. That we kept on like updating
the bulb.
Yeah, like all the time.
Like I couldn't leave the bedside. Like
yes.
and we were just dumping it, because that just goes to show you like with the warfarin how that works. And just his blood was too thin, and so it just kept on, he wasn't able to clot. So he wasn't able to clot, so that was, we're probably getting too
Yeah.
detailed right now, sorry, but that's what, that's what happens. And so then the very next day, so that was Friday was the surgery, Saturday was that what we just mentioned, Sunday was the opposite. So there was nothing coming out, and do you want to say, what did you tell me about the pain for your leg?
Yeah, the pain in my leg was like the worst pain I've ever had, like worse than my chest, worse than the recovery of the chest and dissection. Anytime I would move my leg, it felt like it just felt super bad.
Yeah, he has described it as just terrible. So we got him down to the hospital again that Monday. And so what went from the removal of the kind of like benign tumor, because of the complications with the warfarin and the bridging and whatnot, that went from kind of not being able to clot to not, like, it basically the cavity that was removed was then replaced by a very large hematoma, the same size hematoma. So then we had to go back down to the hospital, and they had to kind of open up the incision again and remove that hematoma. And then at this point, um, because again, this is not typical, the fact that they're not related, like
Right.
the ALT in his leg is totally unrelated to anything to do with his heart whatsoever, totally benign. It's just the fact that you have the warfarin and the complications. So again, warfarin saves his life. Warfarin keeps his blood the way it needs to be so that his mechanical valve continues to operate optimally, so that the mechanical valve doesn't get, a clot and him have another stroke, which did happen at one time too. So, um, but yeah, so I mean, ultimately, you have a really nice scar on your leg too,
Yep.
right? Another scar, and so but after we figured that out, everything's been fine, and they know that he just needs a little bit more managing when it comes to the warfarin, and there's stuff in his chart, um, what to say, what to do, and I guess bringing it back to the advocacy portion of it too, right? Because I know that I'm the person that will kind of say what I feel, and I'm gonna say it in the hospital. And I've actually said to his cardiologist one time, like, hey, I'm sorry that we're asking you these questions. And he's like, absolutely not. You keep doing it. Keep doing it. He's like, and they're always just like, oh, you saved his life. So, like you have to trust your gut. You have to advocate. So there's that. There's also kind of recognizing certain things. We talked about the warfarin and his blood thickness, thinness, the INR, and one Sunday, well, you mentioned you had to have another stent.
Yep.
Like he had to have another stent one time. So throughout all of this, again, always being very, very healthy, he wasn't feeling well one day, and this was like 3 years ago, probably, right?
Yeah.
Probably like 3 years ago. He wasn't feeling well. We were actually headed to Sedona to hike. So just as an FYI too, our first time back to Sedona was September of 2020. So in May of 2020, he went through all of that. And in September of 2020, he was still on top of Cathedral Rock. So, just kind of goes to show like that you're still able to you always get cleared.
Yep.
Yeah, we always go to the doctor, he gets cleared. So he's still able to do all the things that he loves to do and we love to do and the kids love to do. We just kind of do it through the lens of what our new norm is now. So we talk to the doctors, we get cleared. Um, and again, September of 2020, he was great. They cleared him and, everything was fine. He had the type B dissection surgery the year after. And then another time, I think a year after that, he wasn't feeling well. And so, do you remember how you were feeling? Just like sluggish and
Yeah, sluggish, tired,
winded.
winded. Yeah.
Yeah.
Yep.
And so they basically said, you know what, everything has been such an emergency. And you're only, I think at this point, you were still under 50, you know, it was like 3 years ago. We've never tested your arteries. Let's go to the cath lab and test your arteries. And sure enough, even though he's always been healthy, um, he was diagnosed with coronary artery disease. So that came out of the nowhere as well. Never had any issues with that whatsoever. Um, so, you know, that is something else he takes medication for as well. And then one Sunday morning, we were kind of getting ready. We have a hot tub. We were actually getting ready to have coffee in our hot tub in the morning. And I asked him a question and he answered, but his answer was really just not related to what my question was at all. And I didn't know what to think of it except for this doesn't feel right. And all I can think of is I'm gonna ask him a question and what is something a grown man should know? And I said, say your ABCs. I don't know how I came up with it. I said, say your ABCs, and he said no. He was looking at me like, I know my ABCs. I'm not gonna say my ABCs. And then I said, say your ABCs. And he said he started to say his ABCs. He got to probably, I don't know, D, maybe something like that. And he couldn't say the rest of it. So at that point, he knew something was wrong. I knew at that point something was wrong. So I just made him sit down on the chair. And, you know, one of the kids, I think Caitlin was here. Two of the kids were here. And I basically told him that we were taking daddy back to the hospital. So sure enough, he did have another stroke, and that was related to his warfarin, his INR, I should say, his blood level. So, and the result of that was because he had had a stent procedure, I mean, to go into the cath lab to see about a stent, I should say, and they bridged them beforehand, which is what they're supposed to do. But they didn't bridge him afterwards. So that day, you know, he was at 1.0. So if you're new at all this and we understand, you know, we've been there, we've done it, we're doing it. But pretty much everyone's sort of like INR, I guess the level, like the standard is like base level is 1.0. His range is 2 to 3, but ideally the doctors want him to be 2.5 to 3, but that's a really tight range. So 2 to 3 is his range, 2.5 to 3 is ideal for him. So he was 1.0 when he left the cath lab that day. And I was like, oh, we're not bridging him back. I thought we usually do the heparin kind of drip to kind of make sure he's back up to a level before we go home. And they said, no, just, you know, take your warfarin when you get home. And so that's what we did. But I guess it was a couple weeks later when he had that stroke. So thank God again, we're so close to the hospital that saves his life. And so they were able to treat him. You still have the blood clot in your brain.
Yep.
Still has it there. That's scary. But they spent a lot of time explaining to us why it can't be removed and it's not harmful at this point, which believe me, for the person that will ask the doctors questions and keep them there for 2 hours if I need to. And they are always happy to oblige. They spent a lot of time talking to us about what had happened for that third time and why it had happened and how to prevent it from happening again. And also why it's still there and why it's okay and why we shouldn't worry about it, right? So this was a couple years ago, and you know, it's kind of weird, right? Do you feel weird to think that it's there?
Never. Yeah.
You don't
Never really think about it.
you don't think about it. But it's kind of, you know, at first it was unsettling for me.
Mm.
Yeah, till they took the time to explain it. But it's it comes with the territory. So, there are different treatments for different people. Again, his just was so, I mean, obliterated. It was pretty much what they called it, his whole aorta. So that's a complete rebuild plus the mechanical valve and everything else. So ultimately, that is the life, right? I guess the other thing is about the genetics. Something, but the kids.
Mm.
You, I need a drink. You can.
Sure. So our our surgeon, he recommended us to get genetic tech counseling. So we did that
Testing, yeah.
testing,
Mhm.
and it came back that I have a marker, like a
Yeah, something on, I think it was the notch one gene.
notch one gene.
Yeah.
So he's saying it's still like kind of in his infancy stage. So there's not too much data yet to say that it's definitely genetics, but
Well, they said that came back, that gene, that it's related to aortic disease and issues. They're still trying to connect it to the
dissections.
dissections.
Yes.
And so then we have to, all right, you can talk about the kids now. Yeah.
Yeah. So then we took him to one of our cardiologists that has seen me a
Preventative.
couple
Preventative.
times, and based off my history, one time Jen was like, yes, she was like, do you really want to do this 3 different times,
Well, it's
or
2 hours to take a history. It was 2 hours.
or just do it all one time and schedule all the kids' appointments at the same time? And he said, yeah, that's a great idea. So all 3 kids came down to the hospital, to the clinic, sat there for a good 2.5 hours or so with
Yeah,
each
it's like
kid.
he cleared his afternoon on a
Yeah.
Friday. Um, and basically had his assistant kind of said, okay, clear the afternoon and schedule all 3. We say kids, obviously they're, like I said, 21, 24, and 26. And they all had testing, not genetic testing just yet, but they all had like the baseline testing for, imaging and whatnot. And then he spent a lot of time with the 5 of us in a room talking about, he's very, he was very, as a matter of fact, I guess,
Mhm.
right, with them. The kids got upset in the room. It was upsetting to hear, but he was very much, this is your dad should not be here. um the genetics show that there's a connection, and we want to kind of get ahead of this and make sure that you guys are safe. And so our kids, again, 21, 24, and 26, are already on a beta blocker and a statin because of the genetic kind of component of it as well. um but yeah, I mean, we just kind of, we live our life. We go to work every day. We work hard. We continue to hike. The kids come out with us too and hike. They enjoy it. We also love to hike on our own a lot too. So, the kids are older, so we kind of enjoy doing those things on our own a lot as well. Um, we're always safe. We carry a Garmin and things like that with us in case of an emergency. Never had one. Um, he does get cleared for the bigger ones that we want to do, like hikes and stuff like that we want to do. So next weekend we're hiking via Ferrata. And so, there's a whole waiver involved and whatnot. So, he talked to his doctors and was cleared for that. And they said, yep, no problem. Um, and that's kind of like the you're going away, you're going to go do something, but the everyday is, what do you do as soon as you get to work?
I text you.
Yep. Text me, I'm here. And then just texting throughout the day, he's okay, texting when he's leaving so that I know to expect him at a certain time. Just making sure the last thing I do before he goes to bed, or we go to bed, is making sure there's no obstacles in the way, because if he trips, I automatically think if he falls, he's gonna, hit his head and something's gonna happen. Um, Kind of talked a little bit earlier about that whole protocol that they told us on that when he's being discharged that first week, that on that week that he came home, the first from the major event, and that kind of sticks with you. It really resonates with you in the back of your mind, and I'm sure that they did that on purpose so that you do remember these things. And there are, if he falls, if he hits his head, again, even if there's no blood, he needs to be kind of go immediately to the emergency room, and he needs to have a CT scan, and he needs to, let them know immediately. So what happened in March?
Hmm.
Hmm.
We were doing some yard work outside with my son and cutting some trees down. We're throwing some trees over into like the back of the fence or over the fence, and then one of the tree branches came back and kind of smacks me in my head, my forehead right here. So I've got a big welt, some scratches and bruising. So then of course we had to go to the ER.
Wait, did you say he scratching and bruising? That's not true. That's not true. That was
It
like,
was minor.
yeah, it was mom. It was a lot, but it's scary. It was scary for the kids. But I think it's one of those situations where the hospital prepared us really well for any instances like that, in terms of if something happens, these are the things that you need to do. Um, and it sounds scary, but also at the same time, it's the stuff that's those are that's just the facts of our life right now. And so we're prepared, we're armed with what we need to do. And with the care of the doctors and your whole team and us, feel like we know what to do, and also what to look for. We know that, if after having 3 strokes, and we know what I would know what to look for in terms of, a symptom. Again, just kind of recognizing that from the day afterwards, because he just wasn't talking the same, he just wasn't behaving the same, things like that. So just always making sure that we're aware of what to look for, and then also, trusting in the process with the doctors, always checking in. You're really good about, if you have a question,
Yep.
kind of, you know and I think that's something too for you that you've gotten better at, because you used to feel like if you had to go to the doctors or something, I think initially you used to feel that, oh my gosh, they're gonna think here I am again, and you're making a big deal when if we're worried about something.
Right.
But that's never been the case, right? No. So anytime there's been an issue, which is there hasn't been a lot. I mean, we've talked a lot about a lot of big things, and outside of, that other, stroke, and then the time that you just had, that we just mentioned with the hitting
Yeah.
of the head, other than that, there's not been a lot of other bigger things. And so just kind of trusting that, if your doctor, if you've gone through all this and you've survived all of this, which is just a miracle that you did, that when your doctors are discharging you after all that and saying, if you ever hit your head, you need to go to the emergency room and you need to have a scan. If you're not
Mhm.
feeling well, you need to do this, and kind of trusting that they know better, and then just to follow their guidance and saying, we'll just do it, because we've never gone to an emergency room for something like that when they're just like, why are you here? They've always said, it's a good thing you've come. They've always provide you with reassurance that this was the right thing to do. And
Yep.
I think that that's been helpful for you to know that, you have a team of people that will be able to be there to support you. So, but I don't know, I guess the long story still ongoing, thankfully.
Yep.
But that's the life. I mean, warfarin, diet. Oh, you didn't talk about diet. like
with
food.
with being on warfarin, I have to like be consistent with what greens I eat each week. Because if I eat too much greens, then it would make my INR thicker, right?
It's anti-anticoagulant. Yeah.
Should be thinner.
Yeah, thinner. Yeah. We just try and keep it stable each week. So.
Or if I have too many drinks at nighttime or on the weekend, so really trying to keep the alcohol, consistent, with 1 or 2 drinks or so. But mostly it's the vitamin K. So I try to have the same amount of broccoli every week.
Every week, yeah. So you can have as much broccoli as you want, or you don't want. Spinach, lettuce, things like that. But you have to kind of have the same amount, or roughly about the same amount every week. Excuse me, because the vitamin K will impact your thickness of your blood, and your INR and things like that. So, if you have the same amount each week, even if it's a large amount or a less amount, then your medication will kind of be adjusted for it, and then you'll be good. But kind of like major changes in diet, such as, alcohol can do that. So just being consistent with that too. Broccoli, lettuce, things like that. So if we are on vacation, or if we're traveling, and you're kind of like eating bad or something like that, we just try and find some things to still kind of pepper in the amount of like broccoli or lettuce, but I want to say special K, vitamin K, that you would normally have anyway. So, but yeah, what else was there? Anything else? No.
I don't think so.
No, I think.
Yeah. So thanks for joining us and hearing our story.
Yeah, thank you.
You guys are great, I have to say.
She's the great one.
Great. Yeah. My notes go very long. But right away, let's find out. Let's say hi to everybody in chat. Velda and Molly were the most vocal here in chat. Velda says hello. It just turns out that Molly, she dissected the month before you did. She was also under 50 when she dissected, and she also has a mechanical valve. And so a lot of your story is resonating with her.
Yeah.
She says, I have a lot of similar experiences, mainly the mechanical valve, INR, warfarin, bridging, dentist, passing out, and breaking my wrist, and the ER doctors and surgeons are all amazed I lived, which it's always the case.
Yep.
Molly goes on to say, you're very fortunate to have survived a day after you had a type A dissection. You two are an awesome team. I'm sorry I missed you at the bridge walk. She came in from San Diego, and it was a bit of a whirlwind. This was your first bridge walk. What did you guys think of the experience?
We thought it was really powerful. We have to prepare. We had never attended before. And we have 3 dogs. And so we were able to take 1 dog with us and 2 of the kids. And we were trying to get somebody to watch the other 2, but we couldn't. So we were there. We met a lot of people. And then we were not there for the picture, because we sort of like went ahead so that we wanted to do the walk, but we drove in. It was like 2 hours and 15 minutes that morning, did the walk, and then we had to get back to Pennsylvania for the dogs. So we thought it was really powerful. We were really happy. We met the chef and the dietitian. And then we met, and then the nutrition, and then we met the sister of, we're talking to her for a while, the sister of, I guess, Dr. He wasn't your doctor, but he was a lot of people's doctor. He was one of the ones that arranged, he was one of the ones that arranged.
That made the bridge walk.
Yeah, made the bridge. Yeah. And then we got to meet Karen Anderson. So we talked to her a lot, so we actually got a chance to hug her, so that was nice. But yeah, we loved it. It was very, very powerful. It was very moving, and especially to see the amount of people there that had survived, and the amount of family members that were there to support. So we will be back every year.
Oh, that's great to hear.
Yeah.
Yeah, Molly flew in from San Diego. I don't know how often she'll be able to make it, but she really enjoyed
Right.
the thing. She sent me a bunch of fun pictures with people I knew.
Oh,
Okay.
okay.
Let's see here. She totally agrees with you, Jennifer, about advocate, 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 and
Yep.
this is something that's big in the community. Like what we heard from you guys is actually kind of a gold star situation where you have a patient and a caregiver, and the caregiver's taking copious notes. Some people, you get in there, and if you're the only one in there and you were hopped up on post surgery medications, you're not going to remember a lot of anything that's told to you. And so it's great that there's somebody else there that's grabbing that information and able to ask those other questions. And that's thank you very much for your service. Keep up the good work, Jennifer.
Thanks. Actually,
uh,
what I do, I have it on my phone and I did a shared note. So I have a timeline kind of from everything that happened from that day until now, you know what I mean?
wow.
And in terms of medical stuff, we have it on our shared drive on our phones where all his medical files, but it's just like a Word document that I shared with him. So, if he's going to the doctors and I'm not there or whatever, he kind of has that timeline, or if we have to say the story again, and then we just kind of update it as it goes. But, there's just like even the whole like lipoprotein A, all that other stuff. Yeah, there's a whole another thing, we didn't even share about LP little a or something, which is still kind of new. And that numbers really skyrocket for him too. And so, we were keeping track on that timeline too of when those tests were done and stuff. So I think just on a simple iPhone, just a shared document, so he has access, I have access, and
Yeah,
it's
that's a
been
great idea.
helpful. Yeah.
Let's see, we're back here. Advocate, I can't believe they didn't bridge him properly. That's so negligent. I agree. So, you got your genetic testing. Do all three kids have the same genetic disposition, or did you just act as if and treat?
Right now, it just myself who did the testing.
Genetic, yeah. So
Okay.
he had the genetic testing. So he has the cardiologist and then a preventive cardiologist. And the reason why he had to see the preventive cardiologist, surgeon, whatever, I forget his name is, he is because of that LP little a, the lipoprotein A. And at one point they were talking about something about filtering his blood 3 times a week and stuff like that. We're not there. And but he's also not allowed to do the trials. So they're in medical trials to come up for a cure for that. But he's what's the word?
With all the other issues.
Rejected. Yeah, they won't allow him to be in the pretty much. Yeah, so it's all right. Okay. But yeah, so then that's when he said your kids need to come down. And so they did kind of like the not the genetic testing, but they did
Imaging.
yeah, imaging echoes. And then he said, there's not going to be a downside of you taking these medications, but there's certainly going to be a benefit, to be preventative, because so yeah, they haven't had the genetic, just he has.
Okay. Thank you for clarifying that. Where is Villa Fuerte?
West Virginia.
Oh
West
yeah.
Virginia.
Yes.
Velda
A little
asks.
nervous.
Velda asks, how do you cope with the PTSD?
Which one of us?
That's a very good point. In the caregiver community, I'm not sure how many caregivers are willing to admit that they have post-traumatic stress. I've listened in on a few of those calls, and some of the wives and the husbands will be like, if their loved one isn't snoring, they're awake because they feel like something might be wrong. Much like you said, where text me when you get to work. I know that that's weird, and it might feel like we're overstepping, but I want you to text me when you get to work, right? And so for some of the survivors, they don't understand why that's so important. They're just like, I'm not trying to bother you. And it's like, you're not. You're bothering me by not texting me when you get to work.
Yeah, right.
I'm on her side.
Know.
I'm just saying.
Yeah, no. I mean, I totally agree with that. Like, it's for me. I kind of don't really remember a lot of the stuff.
Mm.
I was either out or kind of drugged up, and so it's I thought personally it was more, harder on you and kids than it was for me.
Yeah, I mean,
I just lived it.
I
I just did
just
it, but
lived it.
you had to like you're the one that had to sit there for 14 hours waiting to find out what happened to me.
yeah. No, but yeah, but I mean, well, I mean, and yes, I think the fact that we both get emotional at times, the kids do. I know, even at the walk, we were talking to people at the walk, and I could see that the girls were getting, emotional. They were with us. They got emotional in the doctor's office that I mentioned when we were all together. Um, the girls were with us when he kind of fell that day and timber and had a seizure, and it was just like, so and our my son, that was caught on the Ring camera because I had just kind of gotten home when, we were, all this would happen, and he was coming down the stairs to go to work, and when I was telling him what had happened, because it was early in the middle of the night, and so and he was with me the day before because he sat outside the hospital with me, with my sister, when they wouldn't let me in, when he was having a TIA. He'll be happier at home, he'll be safer at home, send him home. And his surgeons were like, I don't even know how he is here at this hospital, let alone survive the hour-long, trip to, or, and that was 20 minutes. But I mean, then when they said he's got an hour left to live, I mean, they brought him right in there, and there was like 14, 15-hour surgery. So, and that, I just remember looking at all my pictures. I remember sitting on the island and just sitting there crying and looking at all my videos. And if you know me, I have 99,000, literally, not even joking, 99,000 pictures and videos on my iPhone. And so just looking at all them, and it was horrible, and it was terrible, and you didn't know. And then he's like, he had mentioned, he's telling me about what bank accounts and to do this and to call this. And I'm like, what? And my mom couldn't be with me, and my sister couldn't be with me, and trying to explain this to the kids, and couldn't. You try to be strong for your kids, but I was a mess, and yeah. But yeah, I think I have a lot of anxiety. I have a lot of anxiety anyway, but put it this way, traveling for work, if I have to travel for work, that causes me anxiety because it depends on where I'm traveling. Thursday, I was a little bit closer to his work, so I was like, phew, something were to happen, I'm actually closer to him. But if I'm traveling anywhere in the opposite direction of where his work is, which is this way, and if I'm usually going that way, towards the west, then I'm further away. And that has happened when I was 2 hours away, and he had called and said, I'm on my way to the hospital. And I packed up, got on the turnpike, and got off the wrong exit, because I was so frantic. So then that made my kind of trip even longer. It's just a lot. And for me, probably it's not even so much the heart. You can hear it, so I can hear the heart. Actually, we probably even forgot to say that part too. The the his surgeon said, so every night I would lay on his chest. Yeah, every night I would lay on his chest, and he'd rub my hair, and I would go to fall asleep, right? So we've been together since we're 18, so we got a system, right? So, and probably like for weeks leading up to that, I was saying to him, like, your heart feels like it's like beating out of your chest. And then he kind of dismissed it, right? Until probably maybe a week or two later, that's when he's like, I actually don't feel good. And then they sent him that heart monitor in the mail because, again, the pandemic. And it had, again, nothing related to that. It's just that happens to be that time. So I can hear his heart ticking. So that I feel better about. But it's the other stuff, like if you hit your head, or if he takes time to pause at a question, I ask him something, and if he takes time to, like, more than in my opinion, 3 seconds or something to answer my question, my brain's automatically thinking, he didn't understand my question. Is he having another stroke? You know, again, that has happened that day, that morning. You know, the first one was when he was on the turnpike. So he's driving when he had a stroke. And that was like, what's the fish name from
Dory.
Dory from Finding Nemo. It was every 30 seconds. Every 30 seconds, the same question. Every 30 seconds. Hi, Jenny. Where am I at? Why am I in this car? And I was like, hi, Jenny. Where am I at? Why in this car? And then it got to a point where like, he's not joking. There's something wrong. So that plus the next day when they sort of like, oh, he's fine. He's just tired. I was like, this is not who I have known and loved since I'm 18 years old. This is not him. And then that other one, that Sunday morning. So just trust in your gut. And I will not apologize to anybody for saying, get in the car, we're going to the hospital. I'm not going to do it. Like, I'm not going to do it. So just advocate, trust your gut. And listen to your doctors, though. Listen to your doctors, you know, like, because again, I know it's kind of, people are just like, oh my gosh, I can't believe you guys do the stuff that you do. But 6 days before he got hit in the head in the backyard, when we were in our own backyard, 6 days, he was dangling on a mountain in Sedona with our kids. You know what I mean? So like we're like literally 6 days apart. We were in Sedona and having a great time showing Sedona to our kids, and you know, with physician's permission. And then we come home and we're doing yard work and he gets nailed in the head. So, you know, we're just living our life. We're living our life the best we can with our new norm, under the doctor's orders, doctor's guidance, doctor's, you know, care, and always listening to them, but also knowing that they're not perfect, they're humans. And so sometimes you have to just kind of lean into your own instincts and say, this doesn't feel right. And if that person doesn't listen, then you go to the next person, and you know, and you hope that you're wrong. You hope that you're wrong. But if you are, that's okay. You just have to trust your gut and don't apologize for just living your life or feeling nervous about something, because that's just the new norm. So
That is a beautiful answer to how you address PTSD. I have to say.
yeah, kind of
You live. That's how
a
you
big
do
life.
it.
Yes.
Did you find any trouble with like bad dreams? Did you have ICU psychosis? Did you have anything like that happen? You were in there for a very short amount of time.
I typically don't dream, so I don't know if it's something that happened at that point, but like, there's very seldom times that I can remember dreaming when I'm sleeping.
Okay.
Period.
Period. At all.
Yeah, ever. He just doesn't. He doesn't
It
remember.
seems very peaceful.
Yes.
Yeah, just a nice soft reboot. That's got to be wonderful.
Yeah.
You don't have any trouble then laying down and getting like, for you, it's just rest time.
Yeah, just rest time. It's, you know, you go to bed. That's why you're there.
You-
Just to sleep.
I
do wake up a lot.
And you do take medication.
Yeah, I take.
He has to take medication to go to sleep, but
Okay, that's my next
Yeah.
question actually.
Yeah.
So you've had 3 or 4 major surgeries in 5 years, something like that.
Yeah.
Right, and between your emergency surgery and then the follow-up TVAR, how much did your medication regimen change?
I think I've been pretty consistent. I guess, originally after my initial, the dissection, I was a lot more blood pressure medicines and
statins.
and I was taking something else too.
You were taking 2 types
Of blood pressure
yeah,
or something.
yeah, and you were also you had warfarin, but I thought you had another one, 2+, but you'd have to take. Then they introduced eventually. You had it was a trio. Remember at one
Yeah,
point it was a trio.
they
It was
called it-
warfarin, and then baby aspirin would you still take, and then there was something else you had to take, and then that was for like 6 months, I think.
Yeah.
And then they would wean you off of that second one, and then or that middle
The
one,
third, yeah,
and now you just take,
the baby aspirin and Coumadin.
yeah, and then you have nitro. We both have keychains with nitroglycerin on his keychain, and is that right? Right?
Yep.
Yeah, on our keychain. Both of us have it on his keychain. If he were to be having, he also had he also had that day in May, he also had a right ventricle heart attack. So we didn't mention that too. So it was a lot all at once. So yeah, they actually had to take out a vein right from his leg. That's somewhere in the hospital, I think. But they were able to reattach it, the coronary artery by itself. So they said it's best to do it the natural, with a natural one. But yeah, I think that, I don't know if that's related because of that right ventricle heart attack, and that's why you've had some chest pains and stuff in the past, but and then you had the one stent surgery. But they do give him nitroglycerin to keep on his keychain. I think you've only had to use it one time, right?
Yeah, not
Yeah.
often. Yeah.
Yeah. Preventative though, but we both have it on our keychain.
But as far as the medicine, I do take less medicine now than 5 years ago.
Yeah, yeah.
As far as my care
Yeah.
from my doctors.
How fast did you get back to work?
I guess it was 3 months later, like right after September, went back to work.
How do you feel like you got used to that? Was that tough? Usually, what I hear is people say things like, "I went to work far too soon."
I mean, I personally never want to work, but
Whatever.
I was also getting bored at home, and I wanted to go back to work. I think, just because like I was just bored at home
Idle hands.
when I was.
Yeah.
Like I would just get up. I would after I got cleared, and a couple months later, or I guess 2 months later, I would just kind of go for a walk in the neighborhood and then come back, and then in the afternoon I'd go for another walk or something by myself.
Yeah, I mean, you had to do like you had like you had some, like I mentioned, like the cognitive therapy and all that stuff here, and then you got to start to feel better because then you had to go to physical therapy at one point too because of your shoulder and stuff. And I think that just goes to speak to, because we are very active, and so I think that because you were very active to begin with, you wanted to get back to being active, and when you're not at work, you're completely bored. So like I would have preferred him not to work. I mean, I would have been like, yeah, no, I want to stay here. I can see you. I have my eyes on you. But you were excited to go back to work. You know what I mean? In terms of, he was definitely just not a sitter. You know what I mean? So, but yeah, and I think that.
But you didn't have trouble concentrating for 8 hours
No,
in
I
a stretch
kind
at
of
that point?
No, and in fact so before this happened, I worked third shift for maybe 2 years or so, 2.5 years.
Yeah.
Worked third shift from like 12 a.m. to 8 a.m. And then when I went back to work afterwards, I did that for maybe 2 weeks, and then I got moved to like the first shift, to the normal shift, 8 a.m. to 4 p.m., which is obviously a lot nicer. But none of the doctors blamed my sleeping on it.
Huh?
Like none of the doctors saying like the third shift.
Oh yeah, no. It was just, yeah. They know that it's genetic. It just kind of came out of, and then the fact that it just came out of nowhere was just kind of crazy as well. What's also nice is like, you also have like the whole, your work knows about it. You know what I mean? Like we kept them very much up to date of what was going on. So we were able to, like, I actually had to process the FMLA paperwork and everything for him. He was able to, I think that day, give me his boss's number and stuff to text and everything. So I was able to kind of keep them up to date. I think it was the day that you were at the first day, right?
Mhm.
Yeah,
Yeah,
the first day that it happened, because he was leaving work when it happened, when he was driving home from the turnpike. So I was able to kind of, I already had their phone number to let him know, like, you know, the first day I was like, hey, this is what happened, and then we're like, ha ha ha, they said it's a TIA. He's not going to remember today, but everything will be okay tomorrow. Well, that wasn't the truth, you know what I mean? So I already had his phone number and was able to text him, and he had gotten the call or the text the day before, like, haha, this is what just happened. You know, they said it's a TIA. And then when I told him what it, you know, now it's a day later and this is what happened, he's like, what? So everyone at work knew what had happened. Everyone was pulling for you. You have like the whole health, what's it called? Like the nursing.
Yeah,
Yeah,
it's
they
like
know.
we have like a health services team
Yeah, so they
that
know.
work with nurse practitioners and PAs and doctors and stuff. So.
Yeah, so they're aware of it, of the ongoing kind of condition, and it's never been an issue or anything like that. So,
That's very good. That's
right?
very, very good.
Yeah.
Yeah. I'm going to chalk up, you know, again, health and age. That's the other thing. You know, this condition. You know, when you Google about it, a lot of that literature is about 65 years old plus people, and so you know you see things that don't have they don't really match up to a 46-year-old healthy hiker. You know, this happened to no genetic predisposition, no foresight. But of all the people that I've interviewed, almost everybody that's under 50 seems to be able to kind of get back to things in a short order. Especially if you don't have like, if you're older with comorbidities, you know, you're already sedentary, things are already kind of starting to slide. That adjustment, being able to get back on your feet, being able to concentrate at work. This is one of the ones. You know, some people have this and they're not able to concentrate for 4 hours at a stretch, much less a 40-hour work week. You know, so that's helpful, super helpful.
Yep.
And then you know having a strong support system at home, that's also massive. That's massive. Yeah.
I got that.
Yes, you do. And the kids are really, yeah, the kids are great too. You know, they're again like they're adults. You know, so they're great and they know. I mean, they kind of know the protocol too. When he got hit in March in the head, and my son was with him, you know, they're right away, Daddy got hit in the head, and everyone converges on the backyard, and like you're walking and wobbling, and you know, again, just kind of everyone knows what that means. You know what I mean? And it may not look that way for other people, but for him or anybody in that situation, it's just it's just the way life is. But again, we're not going to, at that moment, life looks different because we have to treat it different because of the circumstances and the situation. But outside of that, we're working, we're playing, we're hiking, going out to dinner, you know, we're watching our broccoli, we're packing the beds on Sunday night.
I can't tell if you're getting enough or not enough broccoli. I gotta be honest. Is it too much broccoli? Blink twice if you're getting too much broccoli.
Blink twice. He actually likes broccoli. He
See, I
loves
can't
broccoli.
tell. I can't tell.
Yeah, you love it. Yeah. Oh my God. I know it's like, but those are things that people don't real. I think we were just as kind of shocked too when we found out how much a vegetable, right, that he loves. He was fine without spinach, but he likes salads. So having lettuce and salad and, you know, trying to say, you know, having too much broccoli when you would love to, you'd probably eat broccoli every meal if you wanted. Maybe 4 or 5 times a week. You'd like it. You'd like that. We like that. But you can't unless you're gonna have that every single week, right?
Yeah.
So
That's so interesting.
Yeah.
I don't think I've heard of that. That is. Do you
Yeah.
have any advice for the newly diagnosed? Other than advocate.
what?
I'm not sure, just because it happened so quickly for us.
I I think the after part of it is
Sure, there's a bunch there.
listen to your doctors, but also trust your gut. keep notes. I mean, I'm sure I would think a lot of people have some sort of smartphone that can have like things on there, even if it's just a note. But it's so helpful, you know, especially if you are in a situation where something happened and you're out and you're like, oh my gosh, because it's so weird that 5.5 years later that we both forgot about the whole me laying on your chest and saying your heart, like, but that
Yeah.
was 5 years ago, you know, 5 years, 4 years ago. That was one of the biggest things we were telling people, because that's how it started. And honestly, I didn't even think about that until just, you know, in here, remembered, I should
Yep.
say. But I think just keeping notes, because I feel like in the beginning, again, we've never done something like this before, so we didn't know what to expect. But um I feel like in the beginning we're kind of like all over the place with the timeline. Like we have a timeline, but it all just for us, it's sort of like we know the timeline, but each of the points in the timeline sort of impact each other, because you know we started to talk about, you know, the T-bar, but then we're also talking about, you know, the bridging, and then that makes us think about what else happened because he had to be bridged other times, you know. And so just so you feel like you can be like all over the place, and so just having some sort of, I don't know, a timeline, where you could go to a doctor and say, hey, let me read it to you, or something like that, especially, you know, because the doctors they're very busy too, they might not understand, you know, in that moment.
Yep.
But you can kind of, and they'll have that, you know, typically they'll have those records. But being able for us, that has, we've gone into a lot of doctors when we've just been like, okay, here. And then also taking notes. I do that. I pull up my phone. They know that I'm doing it. I have the name of the doctor, the date, and everything that we talked about, and all questions that we have. So I'm prepared to ask them questions that we kind of discussed in advance of our meeting. Um, he usually says, I mean, which is, you've seen that, he'll be like, you ask.
You
And
can
so,
ask.
yeah, you can ask. So then I'll ask my questions. And then I'll be like, I'm listening, but I'm just typing. And so they get it because they know that's what I'm going to do. And it has nothing to do, like, I don't trust them. They just know that I want to have an answer and I want to understand the answer so that we can kind of go back and even look at some stuff. And so then at the next appointment, we'll look at anything that we have to, that might still be residual, that we're still kind of addressing or wanting to know from the last time we were there, or any other questions we have. And I think that that has proved to be really helpful too, because, for example, the bridging. Um, when I was there that day, and he's like, well, he can go home now, da da da. I was like, he's 1.0. We never go home at 1.0. Oh no, he's fine. Just take his warfarin. We never go home at 1.0. And then you're just sort of like, well, okay. And then that had happened a couple weeks later. And then talking to his cardiologist, who prescribes the warfarin but doesn't manage it, I guess. So that was something also for us to get used to, I guess, right? And that's a whole app. And then they call him when he tests, and you know, that's just getting used to that portion of the life, once every 2 weeks to once every week. But just kind of saying, he's like, all right, well, I'm going to write in the chart, but I'm also going to write in the electronic chart. And then we go to, I don't know, maybe several months later, back for an appointment, and I'm like, I don't see it in the chart. Can you just see if it's in the chart? And he's like, you know what, it's not here. I'm like, I want to see you write it in the chart right now. And he did. So he typed it into the chart right then and there, and then wrote in the chart, the paper chart too, like, you know, he should never not be bridged. Any type of procedure, you know, small, big, he must be bridged. And so now everyone knows that. And, you know, that was, he should have been bridged. And then even with that, when we were set, we were told like it's being written into the chart, both electronic and paper chart. That actually didn't happen. Again, people make mistakes, you know, they must have just forgot, whatever, and nothing happened since then, you know. But we need to know, and just advocating. So just kind of taking notes so that when I saw he said he was going to write in the chart, and then we're at the doctor's and they're like, did you write in the chart? Oh, no, I didn't. Please, I want to see you do it right now. Please write it in the chart right now. And so he did, and everything's been fine. So just taking notes has been really helpful, and having them available. Yeah, trusting your gut, right? But living your life. I don't know, right? Like, again, that looks different from everybody. For everybody, some people, if you're a walker and you feel like you can still continue to be a walker at one point or two, even if it looks like a different level, as long as your doctor says, hey, you're cleared for walking, then it's okay to do that, you know, like it doesn't have to be hiking or, you know, biking or, you know, whatever. You know, if you're a shopper, continue to shop. Take me with you. I wanna- so, right? I
Yeah.
mean,
That's
just
funny.
gotta live your life. I think we do a pretty good job through the filter, the lens, our trauma filtered glasses, I guess we like to call it. So,
Right on. Karen has joined the
yep.
chat and she says, the dynamic duo, big heart. You're both doing such a great job spreading awareness and getting people to think aorta and advocate, communicate, and educate through their healthcare journey, rock stars. I agree. You guys tell a very
Thank
good
you.
story.
It's a doozy, but we're so thankful to be able to tell it.
Right on. All right.
Yeah.
Well, I will let you guys get back to planning for next week. I think that's a big hike. Is that what's happening?
Yeah. Yes.
Yes, the cables and everything. Cables, helmets, suspension bridges,
All the fun stuff.
all the fun stuff.
All right. Well, everyone else, thank you so much. Don't forget to like and subscribe. Let's give them a big wave.
Thank you.
Thank you, everyone, and we will see you back here soon.
Thank you.
Thank you.